Good morning, everyone, and welcome to today's workshop on performance management and the grants process. I just want to start by asking if everybody on the phones can please mute so that we don't get static coming through the speakers here. I'm really excited about today's session and want to first off thank Susan Jenkins and Laura House from OPE who are going to be leading today's discussion. As everybody knows, the Office of Performance and Evaluation does a variety of work to help all of the programs across ACL to look at how they can measure outcomes effectively and how we can improve the performance of our programs. We had a session back over the summer as part of our continuous quality improvement process that looked specifically at performance as it related to the grants process. And today's workshop is really in a lot of ways a follow-up to that discussion. As those of you who have been going through the program funding plan process know, one of the areas that is a big point of emphasis and something Mary has been asking folks about as program funding plans have coming through is how do we measure the performance and the impact that our grant programs are having? How do we know that they're successful and how do we know that they're delivering the outcomes that the programs are intended to deliver? And when you're dealing with the grants world and the world of funding opportunity announcements, that can be a challenge to think about because we don't always have direct control over what our grantees do. There's a broad diversity of activities within our grant portfolio, everything from research to demonstrations to some cases where we're running ongoing programs but through a competitive grant mechanism. And the outcomes of those programs and the ways you measure them are going to be very different. So today's session is really going to focus on how do we approach that process of both writing performance criteria into the funding opportunities and then evaluating the progress that our grantees make. And so with no further ado, I will turn it over to Susan and Laura.
So before we get started, and Dan really gave us a charge that we now have a lot to accomplish, I'd like to do just a quick run through of who is here today. So this is Susan Jenkins speaking. Laura House. Lori Gerhardt.
Dan Berger,
Elizabeth Lee. Jennifer Tillery. Christy Sanders. And who do we have on the phone?
Sherry Clark here.
Okay.
Vicky Thomas.
Kimball Gray.
Kevin O'Brien.
David Colangeli.
Shannon Skronsky. Christy Kalinsky.
Okay, well, welcome everyone. And some of you have worked with OPE on some of this. And so Kimball, one of the examples will be very, very familiar to you. Fontaine, an example will be very familiar to you. So a number of you will recognize these things. And as we go through this presentation, we do want to make it very interactive. And so we will be asking questions and looking for answers and discussion and things like that. It is really a workshop and not a lecture. We do want to make sure that you leave with some concrete things that you can try, that you can do. And if you have any questions, we also want to make sure that you fully understand everything we're talking about. Ask the questions as we go along. You don't have to wait. And I will try, and Laura will try, to be conscious of those of you on the phone to give you a chance to ask questions periodically. But certainly chime in and let us know before we move on to something else if you have a question and we haven't given you that space to ask a question. Can everyone on the phone hear pretty well? We have a mic situation. We just want to make sure it's working.
Yeah, you're clear.
Okay, thank you.
Sounds good to me.
Okay, perfect. And I assume everybody in the room can hear me. Okay. Okay, so we're going to start with some definitions. A lot of people use a lot of different words for performance, for outcomes, for leading indicators, lagging indicators. A lot of these are words for the same thing, so we're going to start with some definitions and then talk a little bit about the distinction between evaluation, performance measurement, and performance management. They are related, but they are different things. And a lot of what we're talking about today, most of what we're talking about is performance measurement. But it's important to know how it fits in with the other things. We're going to have some examples and some discussion about realistic methods for identifying the important performance indicators that you're going to want to work into your FOAs, that you're going to want to work with your grantees on measuring, that you're going to present to Mary as part of the attachment C. And then talk about deploying this into each of the stages of the grant process, the pre-award, the award, the closeout, so on and so forth. And it's our understanding that most of you work with discretionary grants, but I believe some of you also may work with formula grants. So we will focus mostly on discretionary where we have a little more room to maneuver, but we will talk a little bit about some things that you can do with formula grants to infuse evidence and performance, but we will focus mostly on discretionary. Are there any questions before we dive in? Okay. So why do we do this? Everybody from OPE believes it's the right thing to do, but other people believe that as well. And so we did pull some material from the current administration stance on this. And so one of the things that they put forward in one of their documents is to be successful, agencies need strong evidence infrastructure. So we need a way to define evidence, a way to gather evidence, and a way to use evidence, including hiring, deploying trained staff, which is not what we're talking about today, ensuring independence and rigor in statistics and evaluations, and that's part of what OPE does, and many of you come to us with questions about data or evaluation plans, and we're very happy to do that. That's what we do, and we love doing it, in case you didn't know. Using cost-effective, cutting-edge methods and bringing evidence to bear in policy and program decisions, and that's really that last part that we're talking about today. That to make policy decisions, funding decisions, decisions about what direction we're going to go, we need evidence. And part of that evidence is the performance measure that we can gather from our grantees. And so in terms of definitions, the simplest definitions really are, starting from the broadest, from the smallest to the biggest, performance measurement. It really is the foundation for most of this other stuff. So performance measurement is what level of performance is being achieved by your program. You fund a program to do a certain thing, and the performance measurement is the extent to which that thing is happening. And performance measures tell you the what. What is happening? How many people are being served might be a process measure. What number of people are remaining in their homes that otherwise would have gone into an institution? That might be an outcome measure, but it's the what. That can lead into program evaluation, which is the how and the why. You usually have a comparison group. It may be before and after the program is implemented. It may be a similar set of people that are not receiving the program, like in our nutrition and caregiver evaluations. But it tells you why. Why is this program showing the results that it shows compared to people that did not receive the program, communities that are not participating in this funding opportunity? And both of those together can really lead us to performance management. It's not enough just to collect the performance measures or the evaluation data. We have to then fold that back into our funding process, fold that back into our policy making, and manage based on those data. Do we continue to fund people? Do we continue to fund them in the same way? When we think about a new funding opportunity, and I know a number of you have done that recently, well, how should we structure this particular funding announcement? How should we structure the nutrition innovations? How should we structure the PRC grant program? That's where this data can help you to manage performance better, answer some of those questions. And so because we're focused mostly on performance measurement here, we'll get into some more definitions of performance measurement. And sometimes people disrespect performance measurement and say, we need evaluation. We always need evaluation. That is not true. I love evaluation, and as much as I love it, we don't always need evaluation. Performance measurement, sometimes knowing what is happening and how much of that is happening, is sufficient. Especially if you have an evidence-based program that you know if it's implemented with fidelity, it works. You don't need to keep proving that it works. You just need to measure what is happening. So that's just an example. But performance measurement is always directly related to the stated program goals and objectives. So you have to have clear program goals and objectives. And they have to be realistic and they have to be measurable. But that's what your performance measures are. They're not somebody's idea of what we should be measuring. They're not the stakeholders saying, well, this is what we can measure. That might be lovely, but it's really supposed to be related to the goals and objectives of the program. It measures the progress of the activities and the results of those activities quantitatively. Qualitative information is important, the text, the stories, the case studies, but performance measurement is quantitative. It's the numbers, the counts of various different things. The counts of how many people did not have an emergency room visit. The counts of the number of people that did not have a readmission within 30 days, those types of things. It's not exhaustive. It is more of a temperature reading. And so an example related to temperature is we could know that it's 60 degrees. In this room, it's actually probably 80 degrees. But let's just... Yeah, so those of you on the phone, you're probably lucky because it is a little bit warm in here. But okay, so let's say we know that it's 80 degrees in here. That's a temperature. That's what performance measure can tell you. You can measure how many days the room in here is 80 degrees. You can count that. Those are numbers. That's quantitative. Evaluation would tell you why. Is it 80 degrees because it's boiling hot outside and the air conditioning isn't working? Is it 80 degrees because it's freezing outside and the heat is turned up too high? Is it 80 degrees because there are too many people in the room? It's scheduled for 100 people, but we have 500 people in here. Evaluation tells you the why. The temperature is the what, it's 80 degrees, that's the performance measure. Evaluation is the why, and then performance management is what do you do with that information? So you know it's 80 degrees, and for whatever reason, with the performance measure, we don't want it to be 80 degrees in here, so what are we going to do? How are we going to manage that information? We're going to turn on the air conditioner, turn down the heat, let some people out of the room, whatever the case is, but we use that data to do something to make it not 80 degrees in here anymore. But it's just a temperature reading. It tells you the what, not the why. And sometimes what is all you really need to know. And so a couple more definitions. Performance measures may address the types or levels of the program, so the inputs, so how many grants did we offer, things like that. The direct products and services, which are the outputs, so how many people did we serve, how many sessions did we offer, how many people did we train, or the results of those. Yes, on the phone? Okay. Or the outcomes, which is always what I call, what OPE now calls the so what. And I think Mary's starting to call it that too, the so what. So we trained people. We have very well-trained people. So what? Are they doing their job differently? Are they providing services more efficiently, more effectively? Are people who are receiving those services doing better because we train the people? That's the so what. Those are the outcomes. And performance measurement is the ongoing monitoring of this information, which is why it's just the what. The how and the why, the evaluation, is a lot of time and effort and expense, and we can't do that every 6 months or every year. So performance measures sort of carry us through. That's the ongoing routine monitoring. And so it is less than evaluation. It just tells us the what, but it's very important. And I will stress again, it tells us progress towards the pre-established goals. So when we write a funding announcement, when we look at our authorizing legislation, we should know what the goals are, and we should be able to start the process of developing performance measures instead of waiting for the grantees to tell us what the performance measures are, because it's towards the pre-established goals, and ACL establishes those goals by and large, or Congress establishes those goals. We know what those are, so we know at least the areas of the performance measures before we even go out the door with a FOA. And I'll ask the question, who knows the difference, and it's on the slide obviously, between outputs and outcomes? Who's confident that they know the difference between outputs and outcomes? You know, Laura, you can raise your hand. Yeah. Yeah, but I figured I'd ask everybody. On the phone, Is there someone who's very confident that they know the difference between outputs and outcomes? And no one in the room raised their hand, so I don't want to put you on the spot like
the
everybody else
OPEs.
here knows. The OPE people, we raised our hands. That's our job.
Susan, this is Tom.
Yes.
I think I do, and then some days I wonder if I'm right or not, because the outputs are easy. Outputs are what the program is doing.
Yeah, the
You
activities.
you're producing a webinar as an output.
Mhm.
The outcome is what change in behavior does the webinar create?
Mhm.
Now, what an output is, though, is really defined by what the purpose of the program is. The purpose of the program is not to create a webinar. The purpose of the program, the TBI program that we run, the purpose is to help people with TBI live better,
Mhm.
live a better quality of life. And how if that's the outcome,
Mhm.
that's a lot tougher to measure, and it's a lot
Yes.
it's a lot harder to define, actually, because what do you mean by quality of life? What do you mean by person with TBI? Do you mean a person with TBI that you touch, or do you mean a population of everybody with a TBI?
Mhm.
And I remember working on programs earlier in my career that dealt with community development and things like that, and we always did logic models, and the far right column in the logic model was
Mhm.
always solve world poverty
Mhm.
and things like that. So at some point it becomes an exercise in futility, but so I think the trick is where do you go? How far out do you go with the outcome?
Yes. And so I think we have a new friend of data. And so thank you, Tom. But yes, everything that you said is true. The output is the measure of activity. So all the verbs that you have in your FOA, we're going to train people, we're going to serve meals, we're going to conduct research. Those are activities. So how much of each of those you did are your outputs. So how much? The outcomes, as Tom said, is really that so what? How are people's lives different? How are systems operating differently? How are communities different? More dementia capable, for example. Those are the outcomes. And it does get hard when you move the outcomes into outcome measures and you decide literally what is it that you're going to measure. And how are you going to measure creating world peace, as it were, or making lives better for everyone with a TBI. That's where you really have to start to define what is the nature of the program. But yes, you have the outcome, and then you have to determine how to measure it. And we've heard lately some more terms for outcomes than we had used previously. So we have short-term or immediate outcomes. That's the first change that you expect to see, which is generally a change in perception, knowledge, awareness, those types of things in people. They know now that there are services that they didn't know about before. If they have a problem with their pension, they now know they can go to the pension counseling center. They now have knowledge that they didn't have before that they can do something with. Then you have your intermediate or medium-term outcomes, and those are changes in behavior. Now you actually do check your Medicare billing because you went through an SMP session. You're doing something differently. You're paying more attention to what you're eating because you went through the nutrition counseling session. And then you have your long-term, which are sort of what Tom was talking about on the far side. We'll show some logic models later of really the bigger so what. People for ACL generally are healthier, are living in the community, are maintaining their health, improving